Hi, I'm Gary Bacher. I'm the Chief Strategy Officer and Chief Officer for Policy and Legal Affairs at Capital Caring Health. Prior to coming to Capital Caring Health back in January of this year, I was also the Chief Strategy Officer at the CMS Innovation Center, or CMMI. Well, I think Capital Caring Health strategy and our execution on that strategy is really focused on our reflections on the future. And I think we see the future, particularly with respect to care for those with advanced or serious illness, as really being one of integration of care. We mean that both in terms of sites of care, different kinds of care, so integration between medical, behavioral types of care and social supported non-clinical services. We see more and more advanced services being provided in the home, especially for populations with advanced or serious illness. And we see kind of the continued growth of value-based care models, whether they be performance or risk-based opportunities. And given that vision of the future, we think the role of those involved in home-based medicine is essential, an important quarterbacking and integration role, and our activities have reflected that vision of the future.
I'm Jackie Kimmell. I'm our Director of Population Health. Before coming to Capital, I was working in the hospital and health system research, and prior to that, working in value-based care. I would just add that I think we see a future where technology can be really useful in supporting a lot of these endeavors with things like telehealth and remote patient monitoring, as well as data and analytics, where we can actually go in and risk stratify a population. Even among those with very serious and advanced illness, we can figure out how we should be approaching these patients, how we should be prioritizing these patients, and how to give the best care to everyone in the long term.
Well, for one thing, I think first it's been really a test of all organizations in terms of our ability to respond nimbly and put kind of emergency and urgent protocols in place to ensure that the mission of providing care to patients and their families and caregivers could continue, both in person as necessary, but certainly in a virtual sense. I think longer term, we see that the impact of COVID has really accelerated three key areas. So one is telehealth in terms of the trends and just use of telehealth and telephonic care. Two, acceleration in terms of alternative sites of care. So things are now occurring kind of in alternative sites where something might have been done, for instance, in a hospital or a nursing home setting, finding alternative sites where different kinds of care can be provided. And then three, flexibility with respect to workforce and licensing. It'll be interesting to see over time just how sticky these changes are, but the general consensus view seems to be there's been a major acceleration of those trends, and it'll just be interesting to see how that plays out into the future.
Yeah, and I would add that once people get used to added flexibilities, get used to added capabilities, it's often hard to roll those back. Even if regulations might revert back, there tends to be, I think we've seen over time, a general push towards added flexibility after these disruptive events.
Well, building on our vision of the future, where there is a lot of focus on integration of both sites of care and the types of care, we think the importance of value-based care models is only going to increase. It's really in value-based care models where there's more flexibility in terms of the kind of care that's being provided, and a focus on keeping patients and their families kind of healthy, safe in their homes. So we've been focused on how we can begin moving into more direct value-based care arrangements, whether that be the direct contracting model or the serious illness population model, both models that have been released by the Medicare Innovation Center, the CMS Innovation Center. And we also think working with payers such as health plans in Medicare Advantage and also Medicaid managed care, including focusing on people that are duly eligible for Medicare and Medicaid and that may be in need of long-term service supports in the home. We've been kind of marshaling all of our energies and resources to make sure that we can extend our mission and support patients and families that need those kinds of services.
I think we're starting to see great progress towards value-based care and value-based models. I think, people have been heralding this change for the last 10, 15 years, but I think you're starting to see a large acceleration of these models due to things like COVID that have made it clear how quickly the fee-for-service environment can change and how value-based models can be a lot more durable and sustainable through these times. I think also the future is obviously models that incentivize organizations to provide the best care for patients and to engage patients as well as they possibly can. So I think you'll see a trend towards aligned incentives for keeping patients healthy and keeping them engaged and happy as long as possible.
Seeing their role as essential quarterbacks and really integrators of the kinds of care that people need. I think the more that they can, those clinicians can build connections across the delivery system and also focus on serving patients regardless of the source of their coverage. And so whether somebody's in Medicare fee-for-service or happens to be in Medicare Advantage or Medicaid, or even receiving coverage from a commercial source of care, the ability for those involved in home-based medicine to serve all different types of people and populations, I think is going to be increasingly important. And the role they have to play, I think, is going to be important in terms of stretching across the delivery system and integrating different types of care. And I think the ability to do all that in a value-based setting, those are kind of the key things that I think those involved in home-based care should really be focused on.